We are getting the latest on COVID-19, and joining me now is Dr. Jorge Salinas from Stamford Health Care. Thanks for being here.
I'm glad to be here.
So we haven't seen a surge in cases due to the Omicron subvariant yet, but it could be coming. We know about the preventative measures, getting vaccines, masking up, but what else can we do to prepare?
Yeah, fortunately, we know how to deal with surges, wearing masks, getting up to date on vaccination, and all in all, trying to, within reason, reduce our social interactions when there are rising rates of infection. So being very judicious in terms of who we interact with and where we interact with people, preferentially trying to avoid crowded indoor spaces.
Let's see. And what lessons have we learned over the past couple of years that'll help us moving forward?
Several lessons. We have to be very proactive. We need to start acting when the curve is going up, not waiting until it reaches a very high level. We have to work together. Always, it is better when we have a coordinated response rather than everybody on their own. That has been true all along, and I think it's still true today. And we need to continue wearing masks. I know that many people find them inconvenient. However, they are harmless, and I think that they can still provide great benefit even if you've been vaccinated.
Absolutely. And British health officials have identified another COVID-19 variant. They're calling it Omicron XE, which combines two different strains of Omicron. We know that viruses mutate and that variants will pop up. Are there any early indications that this could be of serious concern?
No. Fortunately, this is still Omicron, and Omicron happens to be a highly contagious variant. So we knew that already. So I don't think that it increases my personal concern. Our approach should be relatively similar. We need to keep an eye, similar to we keep an eye on the weather. We need to keep an eye on the levels of transmission, and we need to tailor up or down our strategies depending on how much is the virus circulating.
And a new study out of Israel shows that protection from a fourth dose of the vaccine doesn't last for very long, at least in terms of preventing infections. Tell us more about that study. Do you think that may be discouraging for those who may be eligible for another booster?
So booster vaccines are helpful. They have at least two good reasons to receive them. One is the prevention of infection, even though now we are seeing evidence that that protection doesn't last forever. It still will protect you, especially during peaks, during surges of cases. And the other good thing from boosters is that they increase your protection against severe disease. So if you're a person that is at an increased risk of severe disease or death, either because of your age or chronic medical conditions, I think a booster is still a great idea. People should get them. Younger, healthier individuals are not yet eligible for a fourth dose, but that may come in the future. Hopefully, at some point, there will be a booster that is more tailored to the variants circulating at the moment. So the jury is still out on vaccines and boosters. But if you are eligible today, go ahead and get your booster.
And my final question for you, the COVID rates in some places of the world, like Africa, have been far less than in some wealthier countries. Why is that? Is it because of the reporting there, or is there something else to it?
There are data from seroprevalence studies, so looking at antibodies in the blood of people in Africa that have shown that in reality, COVID has circulated extensively in that continent as well. there are some reasons why it hasn't been as noticeable compared to other parts of the world. One, yes, it may be some lack of access to testing and not a strong surveillance systems. At the same time, many African societies are much younger than Northern Hemisphere societies, and therefore the amount of severe disease and mortality may not have been comparable to places such as Europe or the United States.
Okay, great. Thank you so much for joining me today.
Absolutely.